Sue is no stranger to cosmetic procedures. She's had Restylane before and she was happy with the results. She's now looking to refresh the previous work and is considering fixing what she feels are droopy eyelids.
It's been an interest just personally to feel better, look better. And it's certainly the eyelid procedure is something that I've wanted to have done for a very long time. It's sort of in my family, we've had the eyelid problem where we have that excess skin, and it's just something that I'm interested in reducing now, just a personal interest in getting it done.
What's hard when you see patients like this is to just determine the difference between a wrinkle and a fold. She has wrinkles. A wrinkle you can easily fill with something. A fold you need to unfold. So if you look over here, you can see she has what we call glabellar wrinkles, and these are perfect for Botox, make like you're grouchy. So a lot of women would come and say, I don't like this because people think I'm grouchy. And what we can do is just inject a little bit of Botox here, and it lasts 3 to 6 months, and these lines will gently fade. The other thing we're going to do is we're going to be injecting her nasolabial, nose, lip folds. You can see, just look down a little bit, Susan. You can see these are pure wrinkles, so we should be able to get rid of these with a filler. My filler of choice is Restylane. We're going to go ahead with the Botox. First, I'm going to do the wrinkles. You usually find a younger woman in their late 20s, 30s starting to ask for Botox because they notice the muscle wrinkles and they don't really have wrinkles that are there all the time. As you get 30s to 40s, people are asking for Restylane, and as you get to 50s, they're asking for both and thinking more about surgery. What we do at the same time as we do the wrinkle injections, weaken the muscle, which we call the glabella muscle, is we put a little bit of Botox right at the end of the eyebrow here, and just 2 little tiny units, and that will raise the eyebrow on the outside. Now here comes the Restylane. Actually, we're going to use Perlane, which is in the Restylane family. It's thicker than Restylane, and the purpose of it is to fill the wrinkles. I think the trick with injectables is to use as little as possible. I think that you'd like to make a nice soft change that's not too noticeable to everybody else. So I've injected this nasolabial fold here. You can see the upper half looks a lot better on this side than on this side. I think I get the most satisfaction from an injectable when I can do the least that makes them the most happy. And I notice the difference, but it doesn't look fake. Okay, Sue, the injections are done. You're not going to be able to lie down for a few hours for the Botox. And you could go back to the office this afternoon or wait a little bit till the swelling goes down over your lunch, and you'll definitely be back at work tomorrow. And we'll see you later this week.
Great.
Sue had both Restylane and Botox to revitalize her face. Today, she's continuing with a surgical treatment to fix those droopy eyelids.
I'm looking forward to having the procedure, the eyelid reduction done. I think that it will make me feel younger. It will make me feel better. And yeah, when I look in the mirror in the morning, I'm looking forward to having it done, because I just see that excess skin there, and it'd be nice to have it gone.
Before we start her eyelid surgery, I want to point out something really important. The first thing is, above my forceps is eyebrow skin. Below my forceps is eyelid skin. And eyelid surgery removes eyelid skin. So after her surgery, even though we take out this big piece of skin here, she still will have some hanging. In order to make her eyes look as good as they could possibly look, she would need a brow lift. Now we're going to remove some skin.
The person who asks for eyelids is often the person who needs a brow lift. It's a little bit more complicated, because as you age, your eyebrows come down and you get extra eyelid skin. So they often need both. For example, Susan needs both. We're only going to be doing the eyelids because she doesn't want the larger surgery, the bigger scar, the brow lift. So it tends to be, it could be women of any age from, say, 30 to 70 asking for eyelids. The eyelid surgery is a surgery which is quite complicated. During the surgery, you have to make sure that you take off enough, but not too much. And most of all, when you're removing the fat, you have to be careful that you have no bleeding. The issue with the eyes is bleeding behind the eyes, which can cause blindness. It's very, very rare. We're not totally sure why it happens, but the patient can go blind, so you have to be very, very careful to make sure that it's totally dry, not bleeding at the end of the surgery.
We've taken out some muscle. You can see a strip of muscle being removed from there. We've opened up the fat in the eye. She doesn't have that much, actually. Usually it bulges more. This is the central fat compartment. It's got little blood vessels in it, so this is a very precise move. If you notice, I'm not putting any traction on it, and just burning the fat out. Just like to show you what we've done. We initially took out a piece of skin, the length of the eyelid. We then took out a strip of muscle, basically to get access to the fat. That's the essence of eyelid surgery. I'm now going to begin to sew up the eyelid. This is a non-absorbable suture. And we'll just start on the outside and sneak along. So to recap, when we started the surgery, I took some eyelid skin off. I took a thin strip of muscle off. I opened the medial and the central fat compartment and took a small bit of fat from the central compartment. And I'll close her up with a non-absorbable suture, and she'll be ready for her suture removal in a week, back to work in a week to 2 weeks.
Do